Good morning, Miss Jones. I'm Erica. I'm going to be your nurse aide today, and we are going to be giving you a modified bed bath. But first, I'm going to go wash my hands and gather my supplies. I'll be right back. I'm back, Miss Jones. Go ahead and use one of my towels as a barrier over the bedside table so I don't get your table all wet. And I've got to get you a clean gown too. I'll be right back. All right, I'm going to go ahead and provide privacy. Miss Jones, before we get started, would you mind testing this water temperature? Make sure it feels okay. All right, good. So I've washed my hands. I'm going to put on some clean gloves. And I'm going to hide your call light under your pillow for now so it's out of our way. So this first washcloth, I'm just going to get wet, no soap. I'm going to kind of wrap it around my hand like a mitt. And I'm just going to wash the face, starting at the inner corner of one eye, moving outwards. Using a different area of the washcloth, inner corner of the other eye, moving outwards. And then I can just wash the rest of the face. Making sure I get the neck and behind the ears as well. I'm going to take one of my towels and I'm going to gently pat that face dry. Miss Jones. I'm going to go ahead and remove the old gown. If you want to do this first thing, you're welcome to. I like to go ahead and wash the face first. The order doesn't matter. Either way, I'm going to try to avoid overexposing my patient, trying to keep them covered with the sheet, and move them gently. Miss Jones, what's going on with your arm? Let's fix that. Okay. Holding the soiled gown away from my body, I'm going to throw it into the soiled linen container. I'll then take my new towel that I did not use to dry the face with, and I will expose one arm, placing it underneath of the arm as a barrier. Again, trying not to expose my patient. Take my wet washcloth, and I'm going to add some soap to it this time. Get some suds, and then I'm going to wash, starting at the fingertips, getting in between the fingers, going up the hand, up the arm, into the armpit, making sure that I don't go back down with the washcloth. I'm going to take my other clean washcloth. This one will be my rinse rag, and I will rinse starting at the fingertips, going in between the fingers, just trying to get all the soap suds off of the mannequin. Rinsing up the arm. And into the underarm. Again, not going back down the arm with my rinse rag. I'll take my drying towel, the same one I used to dry the face, and we will dry. Getting in between the fingers, the hand, the arm, and into the armpit. At this point, I can go ahead and remove my barrier towel and take the drying towel away. Go ahead and throw them in the soiled linens so they're not in my way. I'm going to put a fresh gown on you, Miss Jones. Again, trying not to overexpose you as best I can. I'm going to ask you to lift your head for just a second, Miss Jones, so I can tie this gown behind you. Okay. Get you covered back up. Your call line is right under your pillow if you need anything. I'm going to dispose of these supplies and I'll be right back to check on you. So I'm disposing of the rest of my linens. And then I'll take my basin and I will empty it into the commode. I will rinse. I'll empty the rinse water into the commode. And then I'll dry the basin. And I'll place it in the designated dirty area. Remove my gloves, wash my hands. All right, Miss Jones, I'm going to hand you your call light. Here you go. Ensure that your bed is in the lowest position to the ground and that it is locked. I can unprovide privacy, wash my hands again, skill complete.